Well, Joel and Lauren, you probably asked yourself, why does it seem like more and more people are getting COVID-19? That's because this new COVID-19 subvariant is making its round. More people are getting infected, but there's a reason for why all of that is happening. Newsflash, COVID is still here.
The virus is tweaking itself to become more infectious.
UNC's Dr. David Wohl says BA.5 is a subvariant of Omicron, and the virus is finding new ways of fighting off our protective efforts against it, which includes vaccines and boosters.
All that immunity makes it harder and harder for the previous versions of Omicron and previous versions of COVID-19 to spread. It just hits a dead end. So it has to mutate, and it does once in a while. And every once in a while, a mutant comes along that can get around this wall.
Which further explains why if you had COVID once, that's not enough to keep you from getting infected again.
I wish that was true. It used to be true. So the immunity, just like vaccine immunity could be weakened, natural immunity could be weakened. So we are seeing people who got infected 2 to 3 months ago now getting infected again.
In fact, Dr. Wohl says half of all new infections is due to the BA.5 subvariant, and the virus is finding luck in transmitting itself from one person to the next.
We've got to outsmart this virus, and the only way we're going to do that is with the tools at hand, and that's building up that wall higher and higher and higher of immunity such that the virus can't get over it. That's our goal.
And at least in the meantime, ICUs, once at capacity, are no longer overflowing.
We are not at a dead end. There's a lot of good news here. People should appreciate that. This could have been a lot worse. We're doing really well, all things considered. And that ICU bed capacity, that's something that we spent quite a while, Dr. Wohl and I, talking about. So I asked him, does this mean that the worst of COVID-19 is behind us? And he kind of joked and said that he wished that he had a crystal ball. He's still waiting to find out. And there's a lot, even as of tonight, that doctors and medical experts are still learning as it respects to COVID-19. We're live outside the State Health and Human Services headquarters in Raleigh. Dewan Hogarth, ABC 11 Eyewitness News.
No crystal ball, but slowly but surely, hopefully, building up that immunity wall as these mutants keep appearing. Dewan Hogarth at DHHS headquarters tonight. Dewan, thanks.